Ultimately, I would like to talk about some other interventions that we can follow for patients with smoldering multiple myeloma, regardless of risk. And I'm going to be talking about some evidence for that. Dr. Urvi Shah from Memorial Sloan Kettering has studies called the Nutrivention studies, wherein she is looking at interventional nutritional approach towards patients with precursor states of plasma cell disorders such as MGUS and smoldering multiple myeloma. So the first study that she had was the Nutrivention study, wherein she provided patients with a whole food plant-based diet and nutrition counseling. Every 12 weeks, she monitored these patients and looked at various parameters, including their myeloma staging workup, looked at some of their lipid levels, hemoglobin A1C, insulin, inflammatory markers like ESR, CRP, IL-6 levels. And then she also studied their microbiome to see if, a plant-based diet was improving the microbiome to a state where the microbiome would be more likely to kill the cancer cells. She did include patients with a BMI over 25 for this study. So she had some very good results published in American Society of Hematology annual meeting in 2021, wherein she found that the BMI had reduced by 7% at 12 weeks for these patients. The A1C had improved by 10%. LDL cholesterol, insulin, IGF-1, adiponectin and leptin ratio had improved for patients over 12 weeks as well. In terms of the microbiome, she did find an abundance of stool butyrate producers as well as levels in these patients. And butyrate has been, something that inhibits one of the pathways called the NF-kappa beta pathway for patients, in the progression from their smoldering to multiple myeloma stage, and even MGUS to multiple myeloma. So this is a beneficial producer to have in the gut microbiome. She similarly found that inflammation had reduced over 12 weeks by following a whole food plant-based diet in these patients as well. She subsequently had two other trials called the Nutrivention 2 study, wherein she looked at not just whole food plant-based diets, but also supplements such as omega-3 probiotics and curcumin in patients with smoldering multiple myeloma. And ultimately, she had the Nutrivention 3 study, which was looking at placebo versus whole food plant-based diet and nutritional counseling in patients with MGUS and smoldering multiple myeloma as well. She does have some exciting results, which she'll be publishing in or presenting at the IMS meeting next week and subsequently in ASH later this year. So, we should all look out for how these dietary interventions are affecting outcomes and progression of patients with smoldering multiple myeloma to multiple myeloma. So in summary, smoldering multiple myeloma can be treated on a case-to-case basis, especially if it's associated with high-risk features. Ultimately, the ideal way to treat patients in this time and era is to enroll them in clinical trials, as there is a gray zone and a paucity of literature telling us exactly what we should be doing at this time. If you don't want to treat smoldering multiple myeloma, you should definitely look into lifestyle measures, which more and more people have been studying can affect outcomes, especially for patients with plasma cell disorders.